Mental Health Addiction Recovery Quiz Questions. Question 1. Which statement made by the patient demonstrates an understanding of the effective use of newly prescribed lithium to manage bipolar mania? Select one that doesn't apply. Option A. I remind myself to consistently drink 6 12-ounce glasses of fluid every day. Option B. I discussed the diuretic prescribed by my cardiologist with my psychiatric care provider. Option C. Lithium may help me lose the few extra pounds I tend to carry around. Option D. I take my lithium on an empty stomach to help with absorption. The correct answer is option C. Lithium may help me lose the few extra pounds I tend to carry around. Rationale. Question 2. A patient with major depressive disorder is started on a tricyclic antidepressant, TCA. Which common side effect should the nurse educate the patient about? Option A. Hypertension. Option B. Diarrhea. Option C. Dry mouth. Option D. Weight loss. The correct answer is option C. Dry mouth. The correct answer is C. Dry mouth. Dry mouth is a common side effect associated with tricyclic antidepressants TAS. TAS block acetylcholine receptors, leading to anticholinergic effects, such as dry mouth. Question 3. How do epidemiological studies contribute to improvements in care for individuals with mental disorders? Option A. Providing information about effective nursing techniques. Option B. Identifying risk factors that contribute to the development of a disorder. Option C. Identifying individuals in the general population who will develop a specific disorder. Option D. Identifying which individuals will respond favorably to a specific treatment. The correct answer is option B. Identifying risk factors that contribute to the development of a disorder. Epidemiological studies play a crucial role in identifying risk factors associated with the development of mental disorders. By pinpointing these risk factors, healthcare providers can implement preventive measures. Question 4. Which of the following would be the most appropriate intervention for a patient experiencing severe anxiety? Option A. Encourage the patient to talk about their feelings. Option B. Use a firm, authoritative approach. Option C. Stay with the patient and provide a quiet environment. Option D. Suggest the patient watch TV to distract themselves. The correct answer is option C. Stay with the patient and provide a quiet environment. During a severe anxiety episode, it's crucial to stay with the patient and create a quiet environment. This approach helps reduce anxiety by providing a sense of safety and support. Encouraging the patient to talk. Question 5. Gilbert, age 19, is described by his parents as a moody child with an onset of odd behavior at age 14, which caused Gilbert to suffer academically and socially. Gilbert has lost the ability to complete household chores, is reluctant to leave the house, and is obsessed with the locks on the windows and doors. Due to Gilbert's early and slow onset of what is now recognized as schizophrenia, his prognosis is considered option A. Favorable with medication. Option B. In the relapse stage. Option C. Improvable with psychosocial interventions. Option D. To have a less positive outcome. The correct answer is option D. To have a less positive outcome. The scenario describes Gilbert as having an early and slow onset of schizophrenia, which typically indicates a less positive prognosis. Individuals with such presentations may experience more severe symptoms and. Question 6. Which intervention is most appropriate for a patient with a phobia of flying? Option A. Exposure therapy. Option B. Cognitive restructuring. Option C. Medication management. Option D. Psychoeducation. The correct answer is option A. Exposure therapy. Exposure therapy is considered the most appropriate intervention for a patient with a phobia of flying. This therapeutic approach involves gradually exposing the individual to the feared stimulus, in this case. Question 7. Ted, a former executive, is now unemployed due to manic episodes at work. He was diagnosed with bipolar I 8 years ago. Ted has a history of 4 drug abuse, which resulted in hepatitis C. He is taking his lithium exactly as scheduled, a fact that both Ted's wife and his blood tests confirm. To reduce Ted's mania, the psychiatric nurse practitioner recommends option A. Clonazepam, Klonopin. Option B. Fluoxetine, Prozac. Option C. Electroconvulsive therapy, ECT. Option D. Lurasidone, Latida. The correct answer is option C. Electroconvulsive therapy, ECT. Electroconvulsive therapy ECT can be an effective treatment for reducing mania in patients with bipolar disorder who have not responded to medication. In Ted's case, where he has a history of bipolar I disorder. Question 8. Which behavior is consistent with therapeutic communication? Option A. Offering your opinion when asked to convey support. Option B. Summarizing the essence of the patient's comments in your own words. Option C. Interrupting periods of silence before they become awkward for the patient. Option D. Telling the patient they did well when you approve of their statements or actions. The correct answer is option B. Summarizing the essence of the patient's comments in your own words. Summarizing the essence of the patient's comments in your own words is a key aspect of therapeutic communication, as it demonstrates active listening and understanding. It shows the patient that their words have been. Question 9. Which therapeutic communication statement might a psychiatric mental health registered nurse use when a patient's nursing diagnosis is altered thought processes? Option A. I know you say you hear voices, but I cannot hear them. Option B. Stop listening to the voices, they are not real. Option C. You say you hear voices, what are they telling you? Option D. Please tell the voices to leave you alone for now. The correct answer is option C. You say you hear voices, what are they telling you? The correct answer is C. You say you hear voices, what are they telling you? Because it employs therapeutic communication techniques that validate the patient's experience while encouraging further. Question 10. To provide effective care for the patient diagnosed with schizophrenia, the nurse should frequently assess for which associated condition? Select one that doesn't apply. Option A. Alcohol use disorder. Option B. Major depressive disorder. Option C. Stomach cancer. Option D. Polydipsia. The correct answer is option C. Stomach cancer. Schizophrenia is often associated with comorbid conditions such as alcohol use disorder, major depressive disorder, polydipsia, and metabolic syndrome. Stomach cancer is not a common associated condition with. Question 11. In a patient with bipolar disorder, which symptom would indicate a manic episode? Option A. Excessive sleeping. Option B. Low self-esteem. Option C. Decreased need for sleep. Option D. Anhedonia. The correct answer is option C. Decreased need for sleep. The correct answer is C. Decreased need for sleep. A decreased need for sleep is a hallmark symptom of a manic episode in bipolar disorder. During manic episodes, individuals may experience significantly reduced. Question 12. Tatiana has been hospitalized for an acute manic episode. On admission, the nurse suspects lithium toxicity. What assessment findings would indicate the nurse's suspicion as correct? Option A. Shortness of breath, gastrointestinal distress, chronic cough. Option B. Ataxia, severe hypotension, large volume of dilute urine. Option C. Gastrointestinal distress, thirst, nystagmus. Option D. Electroencephalographic changes, chest pain, dizziness. The correct answer is option B. Ataxia, severe hypotension, large volume of dilute urine. The correct answer is B. Ataxia, severe hypotension, and a large volume of dilute urine are classic signs of lithium toxicity. Ataxia refers to a lack of muscle coordination. Severe hypotension indicates dangerously. Question 13. Natasha's husband died suddenly 2 months ago, and she has been overwhelmed with grief. When Natasha is subsequently diagnosed with major depressive disorder, her daughter, Nadia, makes which true statement? Option A. Depression often begins after a major loss. Losing dad was a major loss. Option B. Bereavement and depression are the same problem. Option C. Mourning is pathological and not normal behavior. Option D. Antidepressant medications will not help this type of depression. The correct answer is option A. Depression often begins after a major loss. Losing dad was a major loss. When individuals experience a significant loss, such as the death of a loved one, it can trigger major depressive disorder. This is because the intense grief and sadness associated with the loss can lead to the. Question 14. Tammy, a 28-year-old with major depressive disorder and bulimia nervosa, is ready for discharge from the county hospital after 2 weeks of inpatient therapy. Tammy is taking citalopram, Celexa, and reports that it has made her feel more hopeful. With a secondary diagnosis of bulimia nervosa, what is an alternative antidepressant to consider? Option A. Fluoxetine, Prozac. Option B. Isocarboxazid, Marplan. Option C. Amitriptyline. Option D. Duloxetine, Cymbalta. The correct answer is option A. Fluoxetine, Prozac. Fluoxetine Prozac is a suitable alternative antidepressant for Tammy due to its approval for the treatment of bulimia nervosa. It belongs to the selective serotonin reuptake inhibitor SSRI class of. Question 15. Which statement by the patient indicates a need for further teaching regarding the treatment of major depressive disorder? Option A. I have been on this antidepressant for 3 days. I understand that the full effect may take weeks to occur. Option B. I am going to ask my nurse practitioner to discontinue my Prozac today and let me start taking a monoamine oxidase inhibitor tomorrow. Option C. I may ask to have my medication changed to Wellbutrin due to the problems I am having being romantic with my wife. Option D. I realize that there are many antidepressants and it might take a while until we find the one that works best for me. The correct answer is option B. I am going to ask my nurse practitioner to discontinue my Prozac today and let me start taking a monoamine oxidase inhibitor tomorrow. Choice B indicates a need for further teaching because the patient is planning to switch directly from Prozac, an SSRI, to a monoamine oxidase inhibitor MAOI without allowing for a washout period. This abrupt. Question 16. Which of the following medications is commonly used to treat attention deficit/hyperactivity disorder, ADHD? Option A. Haloperidol. Option B. Fluoxetine. Option C. Methylphenidate. Option D. Clozapine. The correct answer is option C. Methylphenidate. Methylphenidate is a central nervous system stimulant commonly used in the treatment of ADHD. It helps improve focus, attention, and impulse control in individuals with ADHD. Haloperidol and clozapine are. Question 17. A patient with major depressive disorder is started on venlafaxine. Which class of antidepressant does this medication belong to? Option A. Selective serotonin reuptake inhibitors, SSRIs. Option B. Tricyclic antidepressants, TAS. Option C. Monoamine oxidase inhibitors, MAOIs. Option D. Serotonin norepinephrine reuptake inhibitors, SNRIs. The correct answer is option D. Serotonin norepinephrine reuptake inhibitors, SNRIs. Venlafaxine is classified as a serotonin norepinephrine reuptake inhibitor SNRI. SNRIs work by increasing the levels of both serotonin and norepinephrine in the brain, which helps alleviate symptoms of depression. Question 18. The school nurse has been alerted to the fact that an 8-year-old boy routinely play acts as a police officer, locking up other children on the playground to the point where the children get scared. The nurse recognizes that this behavior is most likely an indication of Option A. The need to dominate others. Option B. Inventing traumatic events. Option C. A need to develop close relationships. Option D. A potential symptom of traumatization. The correct answer is option D. A potential symptom of traumatization. The behavior of an 8-year-old boy play acting as a police officer and locking up other children to the point of scaring them is likely a symptom of traumatization. Children may reenact traumatic experiences through. Question 19. In the care plan of a male patient diagnosed with a dissociative disorder, the nursing diagnosis of ineffective coping is included. Which behavior demonstrated by the patient supports this nursing diagnosis? Option A. Has no memory of the physical abuse he endured. Option B. Using both alcohol and marijuana. Option C. Often reports being unaware of surroundings. Option D. Reports feelings of not really being here. The correct answer is option B. Using both alcohol and marijuana. The correct answer is B because using substances like alcohol and marijuana can be a sign of ineffective coping mechanisms in patients with dissociative disorders. Substance abuse is often used as a maladaptive way. Question 20. A patient with panic disorder is prescribed a benzodiazepine. The nurse should educate the patient that this medication is typically used for Option A. For long-term maintenance therapy. Option B. As a first-line treatment. Option C. For short-term use due to the risk of dependence. Option D. To treat depression symptoms. The correct answer is option C. For short-term use due to the risk of dependence. The correct answer is C. For short-term use due to the risk of dependence. Benzodiazepines are usually prescribed for short-term relief of anxiety symptoms due to the risk of dependence. Prolonged use can lead to. Question 21. Which of the following is a common side effect of benzodiazepines prescribed for anxiety? Option A. Insomnia. Option B. Weight gain. Option C. Drowsiness. Option D. Increased appetite. The correct answer is option C. Drowsiness. Drowsiness is a common side effect of benzodiazepines prescribed for anxiety. Benzodiazepines work by depressing the central nervous system, which can lead to drowsiness as a side effect. This sedative effect is. Question 22. A client is experiencing progressive changes in memory that have interfered with personal, social, and occupational functioning. The client exhibits poor judgment and has a short attention span. The nurse recognizes these as classic signs of which condition? Option A. Delirium. Option B. Mania. Option C. Parkinsonism. Option D. Alzheimer's. The correct answer is option D. Alzheimer's. The client's presentation of progressive memory changes, poor judgment, and attention deficits align with classic signs of Alzheimer's disease. Alzheimer's is a neurodegenerative disorder characterized by cognitive. Question 23. During a manic episode, which nursing intervention is most appropriate? Option A. Encourage group activities to increase socialization. Option B. Provide a structured environment with limited stimuli. Option C. Allow the patient to engage in physical activities freely. Option D. Give the patient detailed and complex tasks to complete. The correct answer is option B. Provide a structured environment with limited stimuli. During a manic episode, individuals may experience heightened energy levels and reduced impulse control. Providing a structured environment with limited stimuli is the most appropriate nursing intervention. Question 24. When a patient with major depressive disorder is started on fluoxetine, what is the most important side effect for the nurse to monitor? Option A. Weight gain. Option B. Suicidal ideation. Option C. Hypertension. Option D. Hyperglycemia. The correct answer is option B. Suicidal ideation. When initiating fluoxetine therapy in a patient with major depressive disorder, monitoring for suicidal ideation is crucial due to the increased risk of suicidal thoughts or behaviors that can occur, especially in. Question 25. You have been working closely with a patient for the past month. Today he tells you he is looking forward to meeting with his new psychiatrist but frowns and avoids eye contact while reporting this to you. Which of the following responses would most likely be therapeutic? Option A. A new psychiatrist is a chance to start fresh, I'm sure it will go well for you. Option B. You say you look forward to the meeting, but you appear anxious or unhappy. Option C. I noticed that you frowned and avoided eye contact just now. Don't you feel well? Option D. I get the impression you don't really want to see your psychiatrist, can you tell me why? The correct answer is option B. You say you look forward to the meeting, but you appear anxious or unhappy. Choice B is the most therapeutic response as it acknowledges the discrepancy between the patient's verbal statement and nonverbal cues. By addressing both the patient's expressed anticipation and the conflicting,